Imagine eating something delicious that doesn't spike your blood sugar, but actually helps lower it. Sounds impossible, right? But the truth is, some fruits do exactly that. Today, you'll discover 3 surprising ones every diabetic should add to their grocery list, starting now. One fruit that deserves your attention is star fruit, also known as carambola. This tropical option is often overlooked, but it offers a crisp texture and a mildly tangy sweet flavor that stands out in any meal. Star fruit is especially notable for its impact on blood sugar control, making it a smart choice for those managing diabetes. A medium star fruit has under 10 grams of net carbohydrates and around 3 grams of fiber, according to Food Data Central. It provides about 34 milligrams of vitamin C, which is 40% of your daily value, along with potassium and small amounts of B vitamins. With a glycemic index near 40, star fruit releases sugar at a gentle pace rather than causing a rapid spike. Its soluble fiber slows sugar absorption, helping you avoid sudden increases in blood glucose after eating. This steady release of energy is important for keeping blood sugar stable throughout the day. Star fruit's versatility makes it easy to add to your regular meals. You can slice it for a refreshing snack, blend it into a smoothie for a citrusy boost, or toss it into salads for a unique flavor. Its star-shaped slices also make for an appealing garnish that adds color and nutrition to any dish without overwhelming your carbohydrate intake. However, there is an important consideration for some people. Because star fruit contains oxalates and the toxin caramboxin, those with advanced kidney disease should consult a doctor before eating more than half a fruit. For most people with healthy kidney function, enjoying star fruit in moderation is safe and beneficial. Adding star fruit to your diet offers more than just a sweet taste. It supports stable blood sugar, provides key nutrients, and brings variety to your meals. But star fruit isn't the only fruit with surprising benefits for blood sugar management. There's another fruit, often misunderstood, that can actually help lower your blood sugar instead of raising it. Tart cherries, especially Montmorency tart cherries, offer a unique way to support healthy blood sugar levels. Although sweet cherries have sugar, Montmorency tart cherries rank low on the glycemic index, GI approximately 22 to 30, which means they don't lead to rapid spikes in blood sugar. Their real strength lies in their high concentration of anthocyanins, the antioxidants that give tart cherries their deep red color. These antioxidants cut inflammation markers in the blood, improving insulin sensitivity, an important factor for anyone managing diabetes. Research supports these benefits. In a 6-week trial, participants who drank 30 milliliters of tart cherry juice daily, about the same as eating 90 to 110 cherries, saw lower insulin levels. One study found tart cherry capsules reduced insulin by up to 15% in 6 weeks. The participants in these studies had metabolic syndrome, a condition closely linked to type 2 diabetes, which makes these results especially relevant. The combination of anthocyanins, other polyphenols, and dietary fiber in tart cherries works together to slow sugar absorption and promote more stable blood sugar levels. Tart cherries also contain polyphenols and fiber, which further support blood sugar management. Fiber slows down digestion, ensuring that sugars are absorbed gradually instead of all at once. Polyphenols help the body regulate glucose, creating a more balanced response after meals. This makes tart cherries a practical addition to a diabetes-friendly diet, especially for those looking to avoid sudden changes in blood sugar. When adding tart cherries to your diet, it's best to choose unsweetened tart cherry juice or standardized capsules, since dried versions often add sugar. Tart cherry juice provides a concentrated source of beneficial compounds, but always check for unsweetened varieties. Capsules are another convenient option, offering a reliable dose of the active ingredients without added sugars. Tart cherries provide more than just blood sugar support. They may help reduce inflammation, improve sleep quality, and aid in muscle recovery after exercise. For people managing diabetes, these additional benefits make tart cherries a smart, functional choice. While tart cherries are a strong ally for blood sugar control, there are other lesser-known fruits with equally impressive benefits. Some options might surprise you. One in particular comes from a cactus and offers a fiber boost that can make a real difference in your daily routine. Prickly pear cactus, specifically the thick flat pads known as cladodes, has a long history in traditional medicine and is now gaining attention for its role in blood sugar management. Native to the Americas, these pads are not only a staple in regional cuisine, but have also been studied for their impact on diabetes. It's important to note that the benefit comes from the pads, not the prickly pear fruit itself. The standout feature of prickly pear cladodes is their rich fiber content. Both soluble and insoluble fibers work together to slow the absorption of sugars from food, which helps prevent sharp increases in blood sugar after meals. In one study, eating 85 grams of nopal pads with a high-carbohydrate breakfast cut postprandial glucose by 20 to 30%. The fibrous polysaccharides and pectin in the pads are responsible for this effect, helping to regulate how quickly sugar enters your bloodstream. Cladodes also contain betalain pigments, which protect insulin-producing cells and ease inflammation. These bioactive compounds have been linked to improved insulin sensitivity, meaning your body can use insulin more efficiently to move glucose out of the bloodstream. This combination of fiber and betalains makes prickly pear pads a practical option for supporting stable blood sugar levels and potentially reducing the risk of diabetes-related complications. For best results, research suggests following dosages used in clinical trials. Diabetic trials typically used about 300 grams of steamed pads once before the main meal. Sticking to these amounts can help you achieve the studied benefits without guessing. The sugar-lowering effect of the pads peaks around 2 to 3 hours after eating, so they are most effective when included as part of a regular meal rather than as an occasional supplement. Prickly pear cladodes are versatile in the kitchen. You can grill them, add them to salads, or blend them into smoothies. Their mild, slightly tangy flavor pairs well with many dishes, making them easy to incorporate into your diet. However, individuals with kidney problems should consult their healthcare provider before adding these pads to their routine due to their oxalate content. Now you've seen how these 3 surprising fruits can help lower blood sugar, but they're just the beginning. If you're serious about managing diabetes naturally and enjoying fruit without guilt, you need to see the top 5 fruits diabetics should eat daily to keep those numbers stable, fight inflammation, and support long-term health. Tap the video on screen now to discover what they are. One of them is a total game changer.